Today we'll observe a therapy session using EMDR, eye movement desensitization and reprocessing, to address depression and anxiety. EMDR helps people process distressing memories and change negative beliefs. Let's join the session.
Okay, S1, welcome back. Before we begin the EMDR process, I'd like to review your history a bit more and make sure we're both clear on what you'd like to work on.
In our earlier sessions, you mentioned your depression and anxiety seemed to trace back to losing your job 2 years ago. Can you tell me a bit more about that time?
It felt like everything crumbled. I lost my job, my partner left, and I started isolating. That's when the depression really set in.
That makes sense. Experiences like job loss can become stuck memories that affect how we feel and think long after the event.
That's exactly how it feels, like I'm still stuck there.
Our goal with EMDR is to help your brain reprocess those memories so they no longer feel overwhelming. Let's review how EMDR works. We'll use bilateral stimulation, like moving your eyes back and forth, tapping, or tones in your ears. This helps your brain process memories more effectively.
I'm a little nervous. Will I have to relive everything?
That's a common fear. You won't be forced to relive anything in detail unless you want to. You'll simply notice whatever comes up without judgment, and we'll stop at any time if you feel overwhelmed.
Okay, that feels reassuring.
I'll also teach you a calming exercise now, so you have it ready. Let's practice the safe place technique. Close your eyes and imagine a place where you feel completely safe and at ease.
I see myself at the beach. Early morning, no one around.
Excellent. Notice the sounds, the colors, how the air feels. This will be your mental refuge during EMDR if you need it.
Got it.
Let's identify a memory to start with. What moment from that difficult time feels most upsetting now?
Sitting in my car, right after I was let go. I remember gripping the steering wheel, feeling like a complete failure.
When you think of that moment, what negative belief do you have about yourself?
I'm worthless.
And what would you rather believe about yourself?
I have value no matter what.
That's a powerful belief. Now, on a scale of 0 to 10, how disturbing does the memory feel right now?
About an 8.
Thank you. We'll also note how true the positive belief feels. Right now, how true does I have value, no matter what feel to you, from 1 to 7?
Maybe a 2.
Now let's begin. I'll guide your eye movements. As you follow my hand, simply notice whatever thoughts, feelings, or images come up.
I feel the sadness first, then anger at myself. Now it's like I'm remembering my dad saying you'll never amount to much.
Just notice that, let it pass.
The sadness is softening. It's more like disappointment now.
Good, keep noticing.
I'm thinking about how I kept going, even after losing that job. I found part-time work.
That's important, allow that thought.
It's strange. The memory feels farther away, less sharp.
That's exactly the kind of shift we're looking for. How disturbing does the memory feel now, from 0 to 10?
Maybe a 3.
Let's focus now on your positive belief. I have value no matter what.
Okay.
As you think about that belief, I'll guide more eye movements to strengthen it.
It's starting to feel true. Maybe a 5 out of 7. I'm remembering times I helped my friends through tough spots. They valued me.
That's wonderful. Keep noticing those moments.
I'd say it's up to a 6 now.
Now, scan your body from head to toe. Notice any tightness or discomfort when you think of the memory in your new belief.
My shoulders feel light. My chest isn't tight like before.
We'll close here for today. I'll guide you through a few calming breaths. How are you feeling?
Calmer than I have in a long time.
Remember, it's normal. If more thoughts or dreams come up this week, that's your brain continuing to process. Use your safe place or breathing if you feel unsettled.
I will.
Welcome back. How has the past week been?
Honestly, I feel lighter. I thought about that day in the car, and it didn't hit me like before.
That's a sign. The memory has been reprocessed. We'll check if any remaining distress comes up and address other memories contributing to your anxiety and depression moving forward.
I'm ready.
EMDR can help people move beyond painful memories and change the way they experience depression and anxiety. It is recommended that you work with a trained EMDR therapist. Note: there is evidence that self-administered EMDR can be beneficial. Subscribe for more insights and tools for healing. Start your journey today. This is Dr. Robin, and remember that you are amazing.